the United States has significantly cut foreign aid, impacting several countries globally. Among them is Kenya, a nation grappling with a severe HIV crisis. These cuts have created an alarming situation for many Kenyans who rely on U.S. support for life-saving HIV treatment. The situation is dire, and without immediate action, the consequences could be devastating. The aid cuts have led to shortages of crucial antiretroviral drugs, or ARVs. These drugs are essential for suppressing the HIV virus and preventing the progression to AIDS. Without consistent access to ARVs, HIV-positive individuals are at risk of developing AIDS-related illnesses and even death. The situation in Kenya is particularly worrisome. The country has a large population living with HIV, and the recent cuts have strained the healthcare system's ability to provide essential care. Many patients are now facing the terrifying reality of their life-saving medications running out. Kenya is facing a critical shortage of key antiretroviral drugs. Dolutegravir and nevirapine, essential for HIV treatment, are running dangerously low. Dolutegravir, a preferred first-line treatment option, is now in limited supply. Patients accustomed to its effectiveness are anxious about switching to different medications. Nevirapine, often used for preventing mother-to-child transmission of HIV, is also scarce. This shortage jeopardizes the health of newborns and undermines efforts to reduce new HIV infections. The shortage has forced healthcare providers to make difficult choices, often rationing the limited drug supplies available. This situation has led to anxiety and fear among people living with HIV, unsure if they will receive the medication they need to stay healthy. The consequences of inconsistent access to these medications are dire. Patients risk developing drug resistance, making future treatment more complex and potentially less effective. The impact of U.S. aid cuts extends far beyond Kenya. The World Health Organization warns of a potential global health crisis if funding for HIV programs is not restored. The WHO estimates that over 10 million new HIV infections and 3 million AIDS-related deaths could occur globally if these cuts persist. The cuts have disrupted supply chains, leading to stockpiles of ARVs in warehouses while patients desperately need them. This logistical nightmare underscores the fragility of global health systems and the devastating consequences of funding instability. The cuts also impact other critical health programs, such as those combating malaria, tuberculosis, and polio. The potential resurgence of these diseases, once on the decline, is a stark reminder of the interconnectedness of global health and the importance of sustained investment. The situation demands immediate attention and a unified global response. The U.S. must prioritize global health initiatives and restore funding for HIV programs. These programs have been instrumental in saving lives, improving public health, and bringing hope to millions around the world. The current situation requires a compassionate and swift response. The global community must unite to address this urgent crisis. Collaborative efforts are needed to ensure that life-saving medications reach those who need them most. Advocacy groups and international organizations play a crucial role in raising awareness and urging for increased funding and support. The time for action is now. Every day of delay puts more lives at risk and threatens to unravel decades of progress in the fight against HIV/AIDS. Restoring U.S. funding is not just a matter of policy, it is a moral imperative and a critical investment in global health security.